Your moderator for this evening's recorded event, Dr. Larry Patterson from Crossville, Tennessee.
We've talked about, we've kind of, talking about over-promising, under-delivering, over-promising, or under-promising, over-delivering. Anyway, you know what I'm saying. You can be, like we mentioned the symphony lens. I think it's really important when I'm talking to people, I tell them a couple things. One, you're going to see good at a distance, you're going to see good intermediate. Some of my patients see just fine to read, but some of them don't. And just plan on that you're going to need readers. I'll tell them about some of the starbursts. I'll tell some of the people some of the things they have. But if we're not careful, we can so dwell on the potential negatives that we may talk someone out of a technology they might have been really happy with. So how do you find that?
Well, finding that is listening to the patient. You have to listen to them. You have to kind of understand what their hobbies are, what they are wanting to accomplish through this procedure, through this lens-based and possibly concomitant corneal-based surgery. So the OPD3 for me helps me so much in figuring out how best to customize the implant to deliver what I am trying to achieve for that patient.
There, I'm going to have to find the one whose faults you can live with the best. And so I'm already setting the expectation that I can make life better, but I can't make it perfect. And then I'm able to utilize the OPD to be able to show them what I can and can't do, because what's nice is we talked about the point spread function. There's also the Snellen chart that you can show what the distortion is, but you also have images in there. I think one's of a beach scene, and it really allows us to show them, if I don't fix this, this is what you're going to be left with. And it allows them to understand the value proposition that we're trying to explain to them.
We actually use a lifestyle questionnaire in our pre-op evaluation, and so usually if it's the patient's coming from a referring optometrist, they've already sent a lot of info about the patient. I've known this patient for years. Don't put a multifocal in. They'll tell me, or they want it, it's okay to do it. So that's good intel. But we have a lifestyle questionnaire where you kind of learn a little more about the patient. And then you kind of look at the OPD3 objective data to see how it will match with their subjective questionnaire. And that kind of helps us in how I'm going to talk to a patient before I even go into the exam room.